You have found us again. Welcome to What's Next, Living Longer, Better, Smarter. We have a great session in store. Time for a checkup. This edition is made possible by Vivid Pics. Got a shoebox full of memories? Family, friends, and treasured moments that were captured years ago. Vivid Pics Restore is designed to make restoring old photographs and documents simple. Really just click and fix. It works with PCs and Macs. You'll be amazed, and so will the whole family. At under $50, it's a great investment, and you can even try it for free at vivid-pics.com. And while you're there, check out the new Memory Station scanning solution bundled with Restore. The site again is vivid-pix.com. Time for a checkup is our topic, and we have two different types of checkups in mind, Mary.
Yes, and both are very important. But first, let's talk about COVID and your health.
Joining us is Dr. Florence Comite, who taught at the Yale School of Medicine for 24 years and is also CEO of Grok Health. Thank you for taking the time with us, Dr. Comite.
Thank you for inviting me. I'm excited to talk about this topic.
Well, you are one of the lead authors of a study that included researchers from the Yale School of Medicine, Cornell School of Medicine, and Mount Sinai that found that even mild cases of COVID make you age faster long after the symptoms are gone. Tell us more.
Well, the way it started is that we follow people's biomarkers under the surface periodically. And when somebody got COVID, we were lucky enough in many cases to get testing before it and after. And what we found is that the aging response to COVID was very different for people depending on their chronological age. The turning point seemed to be 50. I'm not exactly sure if 50 is the right age, but that's the way the data worked out because it's still a pilot study. So we don't want to overstate what we found.
And so do we know why COVID ages the body?
That's a great question. It's my belief that what's really happening is age is associated with failures under the surface that we don't see. For example, diabetes, heart disease, we know when people had those conditions, they didn't do as well with COVID. So when we're tackling conditions that I consider disorders of aging, we don't have reserve to really take care of more than maybe surviving COVID, and then the body takes a hit and we get perhaps weaker. And after 50, we're doing more and more of that. So it's quite different than if you're younger than 50.
You also found evidence that the COVID vaccine can help reverse the body's aging process by nearly 4 years in people over 50. It's a wonder if this gets out that there will be lines around the block for the vaccines. Tell us more. And there are different vaccines too.
Yeah, and people respond differently, both very differently to both the vaccine and to COVID. And so the evidence is for us that when your body, when you have a healthy immune system, regardless of the medication you get, a vaccine, an antibiotic, you're going to be able to manage a condition that's a virus or a bacteria far better than if your body is not healthy. And with age, we begin to see decline in muscle, increase in visceral fat, all sorts of conditions that make it more difficult for us to actually respond and survive in great shape afterwards. And that is part of the reason we think we've also seen long COVID persevere. You both may know the data that if somebody is diabetic, they are far more likely when they had COVID to be on a respirator, 4 times more likely. But if they were a diabetic and actually didn't know it, they were 8 times as likely. So not knowing what's going on in our system, whether it's COVID or the vaccination or other conditions, is detrimental to our health, particularly as we age. And I cut that off at 35 in general. Does that help?
Yes. Well, I think we all are trying to be so careful, but it's also a huge wake-up call to move out of a sedentary lifestyle, to be more active, to eat healthy. And I know that lots of people are beginning to think about these issues as they try to
Uh,
come out of COVID. But let us ask you another question about how we measure aging and the difference between our biological clock and our chronological clock.
That's a great question, Mary. Thank you. So what we used is a clock called PC Pheno Age, and it was originally described by Steve Horvath, one of our co-authors on the study who went to Yale. Her name is Dr. Levine, made this clock even significantly more reliable in that we are now looking at over 80,000 what we call GPGs, CPGs, forgive me. So that's 80,000 CPGs versus just several hundred. And because of this notation in the system, we can tell the changes in our DNA. And these are epigenetic changes. So we're born with DNA, that's our genome. That genome marks the kind of diseases we might get, what our health is like. But overlying that, there's something called the epigenome, meaning that can change based on what you just mentioned, working out, putting on muscle, losing fat, maintaining our metabolic and hormonal system. And that's what we're looking at. We're looking at those changes that demark whether your chronological age is actually more in advance of your biological age, which is great. Your biological age is younger, that's fantastic, or the opposite. And looking at both of those factors, we can determine on an individual basis. So we're looking not at averages, but actually at the individual, what we can advise to keep you healthy. Because if we know those factors, if we know those epigenetic factors, we can fine tune targeted and actionable interventions so that maybe taking you for an example, you might be someone who loves to do aerobic exercise. Maybe you're not doing enough to put on muscle, and maybe you need to eat more protein than you're eating, and maybe you need to increase or change your hormonal status so your body can actually lay down the protein. All of that is hard to do as we age because we become weaker and it becomes a vicious cycle.
Well, we've covered pickleball before, and we know that's a very fast-growing sport. I started water aerobics this week, and everyone I think I went to high school with. So there were a lot of 70-year-olds there in the pool. So thank you so much for being with us. And we all need to stay healthy and be careful, right, Fred?
Absolutely. Florence, if I may, just still, there's so much confusion about the variants, what's safe to do, what isn't. And I also recently read that getting COVID multiple times really increases risks for long-lasting effects. What are you seeing, and what is your basic advice, especially for older adults?
I love that question, Fred, because I think of everyone as an older adult, because with every decade of life, we're maturing. I don't think of the word older or aging. I think that our body changes with time, and we see acceleration of that when people are ill. The best we can do for ourselves is understand who we are, where we come from. Family history, for example, is a very rich source of what's expressed from our genes. And understanding that each of us is unique, even as an identical twin. I am an identical twin. It's one of the reasons I started on this path. And I know my sister is very different than me. I got COVID the very first week. COVID was practically invading our country. I happened to be in San Francisco for 36 hours and came back with COVID. No one caught it from me. And then subsequently, all these variants are multiplying so rapidly, it's hard to keep up because we're exposed. The variants are changing because of human exposure. I think what we need to do is be somewhat more vigilant in that if you find yourself out and about in crowds and you don't know who you're surrounded with, wear a mask. It can't hurt. Will it help is another question. I think the most recent variant appears to be able to infect despite masks. Again, that's hard to tell because everybody is out and about now without the mask. We encourage vaccination and then booster for appropriate people. There are folks who hold on to their immune response for months, if not years, after getting the vaccination, and others who really need to have boosters every 6 months or so. And again, there's a slight tilt to maturing. So every decade of life, can make you more vulnerable, except if you're actually focusing on your health. I've had lots of 70 plus, wonderful clients, patients here at the centers, both in New York, Palo Alto, and Miami, and they're in better shape than 35-year-old counterparts. And sometimes it's fathers and sons or mothers and daughters, because if you can focus on the kinds of things we all know might be useful and learn from your own body. I really strongly believe, which is why I'm scaling the center to the internet and digital health, Rock Health it's called, if you guys want to look it up, and it doesn't stop at any age, because we can go on till over 100. 120 is a good goal, in great shape. And by learning what's important to each of us, we can make a difference in how we get through COVID or any infection, which puts us all at risk, and thrive despite it. So I believe this paper, while still a pilot, is really masking the fact that it's not age per se, it's how we live life and what we look like under the surface at the cellular level, metabolically, hormonally, and the rest of it.
And the website that people can go to for more info?
Grok Health, GROQ health.com. We're also on Instagram at Grok Health. And I'd love to entertain everybody's health and make sure that despite aging chronologically, we're actually getting younger biologically.
Dr. Comite, thank you so much for spending time with us.
I appreciate it. It was fun.
Mary, our next segment on our Time for a Checkup episode has to do with money and benefits. With inflation and gas prices still way up there, everyone, especially older adults, can use a few extra dollars.
Fred, that's so true. I watch how careful people shop at the supermarket, and even pass on products that they love because they're a little too expensive now. And so we have some great information for our audience on one of the most trusted sources in aging, the National Council on Aging. I've been an advisor to this group. They do phenomenal work. And so we're so excited to have them with us today.
Right. And they have launched a new and better version of their free online tool, benefitscheckup.org. And joining us from the NCOA is Chief Customer Officer Josh Hodges. Hi, Josh.
Hi, thanks for having me today.
Josh, we're so glad to have you and welcome you back. You've been at some of our Washington events. Tell us more about the changes at NCOA and the changes in Benefits CheckUp and your background and what drove you to join NCOA.
Sure, we'll start with just my background and give you a little sense of that. So I've been with NCOA, or the National Council on Aging, for about 3.5 years. NCOA is a 75-year-old plus national nonprofit with a singular goal of helping older adults age well. And so all of the programs, all of the policies, all of the work we do really is focused towards that North Star of ours, which is, again, is a service to the older adults themselves. Before joining NCOA, I spent about 10 years with the federal government working on Health and Human Services, working at older adult programs. And before that, I worked with different companies as they evolved some of their products and programs. The reason I really joined NCOA is because of the mission. And it really is focused, again, on delivering products that are useful to older adults, products that are simple to use, that help older adults overcome something. And really focus in on that, again, that North Star of just service to the older adults. And that's what Benefits CheckUp is all about. It is a free online tool to help older adults best understand how they can save money, how they can put money back in their pocketbooks, especially during this time of inflation, especially during this time of all of the ongoing concerns. It is a free tool that really helps people at the local level understand how they can save themselves money.
And who doesn't want that these days, right? So can you walk us through how it works?
Sure. So Benefits CheckUp, and it's benefits with an S, benefitscheckup.org, is a website. It's a site like anything else. You can pull it up on your computer, on your mobile phone, or you can have a friend or family member help you out. And it really begins with a single data point, which is your zip code, because all of the information that we provide is local, and it depends on what state, what county, what city you might live in. So if you enter your zip code, you'll then be able to choose any number of benefit programs that you're interested in. So if you come to us and you're a veteran, you can click veteran benefits. If you come to us and you're on Medicare, you click Medicare benefits to understand how we can help save you money on your drug copays or your copays or your drug plans or whatever it happens to be. If you need food service or rental assistance or help paying your utilities, these are all programs that are out there. And really what Benefits CheckUp is a front door to all of these different programs. And the reason we're talking today is it's a fully redesigned front door. We've had Benefits CheckUp for over 20 years. It's always been free. But this year we really went through the process to redesign, to restate it so that it's easier to use and it gives everybody the access to the information. And at the end of the day, what you're going to get is a report. It's going to say, you're qualified based on the information you have for these benefits. Here's how to get access to them. Some of the benefit programs, depending on which state you live in, we can help you apply directly. Other ones, we help connect you to the right people. Because again, every benefit program is managed differently by the federal government or the state governments or the local governments.
Josh, this is so important because I think there's a lot of confusion out there, especially today in the age of the internet and the barrage of commercials on TV where you see all the time, you're entitled to this, call us now. And you wonder what information is real and what isn't. So you're vetting all of this before it goes on the site. Absolutely.
Every program, we have a team of 4 individuals whose full-time job are to vet these programs. And these are not programs that are fly-by-night organizations. These are long-standing programs that are benefit programs for older adults, especially low-income older adults. And it costs nothing. We're not trying to sell you anything. We're not going to ask you for your credit card information. We're not going to sell your email address. None of those things are going to happen. We're a nonprofit with the sole focus of helping connect people to resources. And this is one way we do it because it is, again, designed to be that front door, that opportunity for you to walk in and really understand what you as an individual are eligible for.
And you've been doing this for so long. What are some of the more popular things that people learn on the site? What kinds of benefits are they focusing on?
So I think it really boils down to, there are literally hundreds of benefits, but the most popular ones are related to obviously your food, you're paying for your housing, whether it's rental assistance or helping you cover your mortgage, paying for your utilities, and then of course the big one is Medicare. So many people don't realize until they're 65 that Medicare has a cost to it. You're having to pay out of pocket for it. And those costs can be quite substantial, especially if you're on a limited or fixed income. And so a lot of these programs help cover those costs. Again, whether it's your copays, whether it's your drug plans, it doesn't matter. Another really common benefit that people aren't aware of is a program that helps pay for your energy bills. So if you live in the Northeast and have high heating bills, or if you live in the South, like where I'm at right now with incredibly high air conditioning bills, there are programs out there that help you cover some of those costs. And they're programs that are designed for older adults. So you're not taking dollars away from your grandkids. You're not taking dollars away from other populations. These are specifically targeted towards older adults to help people on fixed incomes continue to live at home.
Of course, it is those basic services, your utilities, your food, your energy, that where people are getting hit very hard, in your water bill in California, among other places. Do you see that a lot of people don't know that these benefits are available? So is the biggest challenge the lack of awareness?
It's really two things, Mary. It is lack of awareness. There certainly is the lack of knowledge of these even exist. And then there's that lack of knowledge of how to get started. It's like, how do I access these? I hear about these programs. I see them on TV. Fred, you mentioned earlier, there's a lot of this onslaught of information being provided to folks, but they don't know how to get started. And so one of the things that Benefits CheckUp and the majority of what NCOA's programs try to do is really focus in on helping people take that activation. How do you activate? How do you start the process? That's why when you go to benefitscheckup.org, you're not only going to see what you may be eligible for, you're also going to see how you might go about applying for them. Again, some of the benefits we can apply directly through our website, or others we link you directly to the state or county or federal website, and yet others we have to just refer to. But either way, you're going to come away with a plan, a checklist, so to speak, a to-do list, so that you can really understand how you can get started, because we really want to help you take that jump.
There is so much work involved with this, Josh, because you've got the 50 states and sometimes even more local governments have programs too. How are you gathering all of this and putting it together for the site?
It's a great question. So, I mean, first off, we've been building up 20 years of experience, but we have a team of four full-time staff whose job it is to ensure eligibility. We have partnerships with federal programs, partnerships with a number of state programs. So anytime they update or change their eligibility guidelines, we update it in our system. But it is a manpower exercise. And this is all free for the consumer because we have a federal grant that helps cover the cost. And so these individuals' job is to ensure that these are up to date as much as possible. And then we're always obviously welcome if there are additional programs out there that people are aware of that we don't have on our list. We're happy to add them as long as they're targeted towards older adults.
Now, of course, we're seeing a lot of new corporate partners come into the field of aging globally. Really, there's a lot of interest. And you have some new philanthropic partners, I know, at NCOA too. I read about, was it Miss Kenzie Scott?
Yes, Miss Scott, yep.
That gave a sizable contribution. Do you also provide phone support?
Yeah, so part of benefitscheckup.org, we have chat support. So you can go on the site and actually click the button and chat to one of our people. And it's not a chat bot, it's a real person. She works in Arlington, Virginia. She's a very nice woman. But we can also call our help desk. If you have a question about benefits or you just would like help getting started, and we contract with a call center. The number is 1-800-794-6559. Again, it's 1-800-794-6559. And you're going to talk to a benefits representative. And that person is either going to help you walk through Benefits CheckUp live on the phone, or if you prefer, they can refer you to one of our many local partners. We have over 90 local partners across the country. Now, to be honest and fair, we don't cover every zip code. That's why we have the call center. But we have a large majority of the country is covered by one of our local on-the-ground partners who can actually walk you through in person. But either way, you're welcome to use our website, talk to our chat person, or call 1-800-794-6559 and talk to our call center.
How much traffic have you been seeing, and has it been increasing?
Traffic to the website, yeah, it's so I mean, over 20 years, in the 20 years we've had Benefits CheckUp up, we've served nearly 10 million people, to the tune of hundreds of millions. That's hundreds of millions of dollars of benefits, and traffic has certainly increased, especially with inflation. You know, I think the biggest question we have is the reason we're doing podcasts like this is we're just trying to get the message out there. You know, we don't have the big advertising budget. You're not going to see Benefits CheckUp on TV because we don't have those dollars. It's a nonprofit. So our goal is to not only get out there for older adults, but also tell your friends, tell other people, tell your family members that this exists. I mean, again, I'm not here to sell you anything. I'm not going to ask for credit card information. I'm not going to try to monetize your or make money off your email address. My whole goal is to get our information out there so people can see it, people can know it, and then people can use it.
Terrific. Well, Josh, congratulations on the work that you and NCOA are doing there. So important.
Thank you very much.
You know, I'm so excited to have this conversation because this is very trusted, reliable information that we just need to get the word out to as many older adults as possible. And we want to have you back and learn more about the new modern senior center. We know you have a footprint all across the country. We also know you're doing really important work on policy around issues that matter to older adults. And we thank you for being kind of a trusted partner with us through the years. So Josh, we really appreciate your insights today. And of course, who doesn't like great user interface design to make it easier for everybody to check out these important services? So it's exciting to have you here. Thank you.
Thank you.
The site, once again, is benefitscheckup.org. Mary, some really interesting guests and important information today.
Yes, the new research about COVID and aging is so important. And of course, the service that NCOA and Benefits CheckUp offers is very wonderful for our audience to know about too. So two important leaders were with us today, Fred, and they're offering information that our audience really needs to know about.
Absolutely. So we want to thank Josh Hodges and Dr. Florence Comite once again for joining us. And thanks as well to our sponsor, Vivid Picks. Find their Restore software for photos and documents at vivid-pix.com. You can find all of our episodes and also the What's Next Longevity Deal Talk podcast at maryfurlong.com/podcast. Thanks for watching or listening.